Welcome back. On this Health and Wellness Thursday, we are going to focus right now on primary care. Why is it important? What do you need to know? A great conversation recently with two experts. Here's more.
The U.S. spends twice as much per person on health care than other developed countries, yet we're less healthy. Studies have shown that the U.S. healthcare system continues to rank last amongst high-income countries. But why? Well, our next guest, two of the founding partners of Primary Care for America, a new collaboration of experts working to shift the conversation by educating people about the value of prioritizing high-quality primary care for everyone. Say fixing a broken system starts with the doctor you may not be seeing. Well, Shawn Martin, Executive Vice President and CEO of the American Academy of Family Physicians, and Dr. Rushika Fernandopulle, Chief Innovation Officer of OneMedical, are joining us live this morning with more. Thank you so much for being here today.
Thank you for having us.
Doctor, what is the main role of a primary care team, and why should we all have one?
So Barbara Starfield, who was one of my mentors, who was a professor at Johns Hopkins, she talked about 4 C's in describing primary care. So it's comprehensive. It's a doctor who looks at your whole person, not just at one organ system. It's continuous, so it's not just at one point in time, but can really follow you and get to know you over time. It's first contact, which means it's the place you can go with any problem. And then it's coordination. It's coordinated. It actually helps you navigate the whole rest of the healthcare system. It's someone who gets to know all of me, sticks with me over time. It's the first place I can go and helps me with the whole system. And health and healthcare are very complicated, and it's what we and our families need in order to actually make the right decisions.
Mr. Martin, studies show the U.S. spends twice as much per person on health care than other developed countries, yet we're less healthy. What needs to occur to improve our healthcare system?
Well, we know that individuals that have an ongoing relationship with a primary care physician or a primary care team experience better health outcomes and have healthier lives than those who do not. So understanding this, we need to prioritize greater access to affordable primary care for more individuals and more families. And then we need to prioritize the physical and mental well-being of those individuals over the course of their lifetime versus simply focusing on them when they're sick.
Doctor, why should patients get involved to influence change when it comes to funding for primary care?
So this is our health and the health of our families. And when we rely on a broken healthcare system without the help that primary care can give, we're vulnerable to preventable diseases, catching things too late, chronic conditions, and making the wrong sorts of decisions. And so a better primary care system will allow all of us to deal with whatever nature happens to throw our way, particularly as we get older. So I've had the privilege to start and run what's called an advanced primary care practice across the country. What we've been able to do is convince payers to pay us differently and invest more in primary care. And that allows us to spend more time with patients, to give them a more robust team, to combine mental and physical health, to help them deal with social issues, and give them the right technology to help monitor and track their conditions. And what we've seen is dramatically better experience, better outcomes, really avoidable complications, keeping people out of the hospital in the emergency room. And it actually cuts the cost of healthcare overall down. And this is exactly what the country and what individuals need.
Mr. Martin, can you share how patients can get involved to influence change, especially when it comes to funding for primary care?
Sure. So we all now understand that primary care is the only type of care that has been demonstrated to improve health outcomes and reduce costs. And as patients, we need to engage with our employers, with our elected officials, and with other individuals who are influencing our healthcare system to share with them that we value this type of care. We value comprehensive primary care, and we want them to prioritize that in our healthcare system. We need to advocate for what we expect from our healthcare system.
Where can we go for more information?
Sure. So we would invite everybody to visit our website, primarycareforamerica.org, to learn more about what is possible when we invest in primary care.
Well, thank you so much, Shawn Martin and Dr. Fernandopulle, for joining us today. Really appreciate your time in discussing this. Very important to keep everyone healthy. So thank you.
Thank you.
Thank you.